We're going to do a sterile dressing change today. As you can see, I've already removed the old dressing from the Manikin using just regular clean gloves. I've done hand hygiene between, and now I'm going to go ahead and open and set up my sterile kit. So I have my sterile dressing change tray here, and I also have a set of cotton-tipped applicators. I'm going to drop this into my sterile field. So I'm going to go ahead and open my kit, and I can remove my gloves. And then I'm going to go ahead and peel this one open and drop it into my sterile field here. So carefully I'm peeling this back and dropping these into my kit. Okay, that one I'm just going to get rid of because it kind of fell out and I don't need to. This does have in centimeters your guide for measuring, so I'm going to keep this so I can tell how big the wound is. Okay, and then I am going to go ahead and put my sterile gloves on. Remember, the outer 1 inch or ½ inch to 1 inch is not considered sterile, so I don't want to touch that after I open it. And we'll go ahead and put these on. So I can touch the cuff here, and I'm going to go ahead and put my right hand in first because it is my dominant hand. Okay. Now, if the cuff is folded over like this, I can't grab in here to fix it because this is sterile, so this just has to stay. Now I can put on my other glove. So we'll keep my thumb away, put this on. Now notice I colored a black dot on this one hand. This will be my non-sterile hand for the procedure. Now to move this trash out of the way, I need to grab from the center of this package and move it. I can't touch that outer inch border. To move this kit, I have to touch the middle of it so that I don't contaminate by touching the outside. I'm going to go ahead and set up my kit here. So I have a drape. I can go ahead and put this on my patient. Normally we put a towel or a Chuck's pad down before we even start because it'll catch a lot of this, but we can drop this one, and wherever it ends up, that's where we're just going to kind of leave it. So I'm going to move it just so you can see what I'm doing in the kit here. Okay, so you can use your sterile drape. Remember, that was a self-identified break. I wouldn't touch that after I've dropped it. I'm going to go ahead and move some things around. I have roll gauze. I have an abdominal pad, some tape that I'm going to use at the end. And right now what I want to do is I want to split some of these gauze. So I'm going to put a couple into here, open this sterile saline, and pour it on, and then this can go out of my kit. So at this point, I'm ready to start. What I want to do first is measure the length and the width and the depth of this wound. So I could, by holding this, I'm not going to touch anything, but I can hold it up and I can approximate the size and measure it. So that would be about 14 centimeters. I'm going to measure the width. So again, I don't want to touch anything. And then I can measure here about 2.5. And then for the depth, I would be inserting this into the wound and looking how far it goes. And that's about 3 centimeters. At this point, if I had a biohazard bag, I would discard that into my biohazard. So I'm still sterile here, and we're ready to begin. My right hand is the only one that can go in the kit because it is sterile. We don't have the syringe to irrigate in the kit, so we're going to irrigate with the gauze. You could get additional gauze if you needed to. I am going to do an exaggerated drop into my non-sterile hand, and I'm going to squeeze this over the wound to irrigate, and then this hand would throw it into the trash. Notice how I don't go back across my sterile field. Sterile hand into the kit, exaggerated drop into non-sterile hand, squeeze this over the wound. This becomes non-sterile because there might be some splash. Now you can do this more times if you need to, but if the return is clear, we can go ahead and move on. So I'm going to do an exaggerated drop again, and this hand is going to take this and blot dry along the outside of the wound here. Okay, I'm not going in it, just around the outside. Trash. Then I am going to go ahead and pack my wound. So for this one, our kit doesn't have another sterile applicator in it. So we're going to say that I had one clean still in my kit. And what I can do is I can pick up with my sterile hand this applicator. I can hand it to my non-sterile hand. And then my sterile hand is going to be the one that holds the gauze that we're going to pack into the wound, because I don't want to touch it with my non-sterile and pack it into the wound and make it dirty. So here I'm going to use this cotton-tipped applicator to guide this down into the wound. Okay, they don't stay in here great, but we'll do kind of the best we can. So I'm packing this down into the wound. I can go back in with my sterile hand and get a second one. And again, I'm going to use this cotton-tipped applicator to guide it down into the wound here. Okay, and we'll do the best we can with our Manikin here. Okay, so now that my wound is packed, I'm going to get rid of this. And we can go ahead cover with the ABD pad. So again, sterile hand only goes into the kit. And I can lay this down over top. Now that it's covered, I'm done with the sterile part of this procedure. So at this point, I am going to go ahead and get some tape. And we can tape down all 4 sides. See if I have enough tape or if we run out here. Okay, perfect. So I've secured my dressing. And then the last thing that I would do is I would write on my label and affix my label. You can put it really anywhere on here is fine, but attach your label so that people know when the dressing change was done. And that's it.